Now, what I want to talk about is symptoms of what I had. I had an 11 centimeter dermoid ovarian cyst on my right ovary. And when I went in to have the ultrasound, the tech and the doctor both asked me if I was in any pain, and I said no. And I got to thinking, like, how is it possible that I had this sizable cyst on my ovary and did not know? So as the doctor was talking me through it, I started thinking about different things that had happened or had been happening with me that could be signs that I had an issue. First thing, my kids would joke, even after I had worked out all summer and eaten fairly well, like there was a pooch in my stomach that I could not get rid of. I just assumed it was age and the fact that I was not giving up sweets. Like, I bought all kinds of books like giving up sweets. I still didn't. But anyway, I attributed the stomach to maybe needing to go harder in the gym and needing to give up sweets. My kids would joke, Mama's having another little baby. Mama's never having another baby, right? Like, that is nowhere in the plans. But they would joke about that because apparently I looked a certain way and just did not know. Like, you see yourself every day, so you don't really take note of changes. But anyway, that was kind of the first thing that I look back on. The second thing, every once in a while, I would get like a nerve tingling down my right leg. And it was almost like a sciatic issue down my right leg. And I just assumed that was me getting old, right? Like, everyone tells you, oh, just wait until you get older. You're going to have all these aches and pains. I assumed that nerve tingling and discomfort in my right leg was attributed to just getting old. I also, and this is probably one of the bigger ones, would get an aching in my back right hip. And it just felt like, I was really tense, or maybe because I teach and I stand and I move around, like maybe my hips were tired. My back hip was tired. So I started going to yoga and going to hot yoga and trying to stretch things out. But I would still have that issue. Another thing is that I noted that I always would lie on my right side, not ever on my left. If I started to turn over onto my left side, my back would hurt and I would flip back over to the right side, always sleeping on the right side. And I think that may have been the weight of the cyst maybe crashing down when I turned over onto my left side. Like, maybe turning over onto the right just put the weight of the cyst in a better spot. So those are kind of the symptoms that I look back on and say, well, maybe there's something to that, because since I've had the surgery, I don't have that issue of that aching sensation in my hip. Granted, I've been home since March, but I do not feel anything in there. There was also some digestive issues, but like, I haven't had those same types of digestive issues since having the surgery. So I feel like so many women have issues, and we might have some signs, but we don't really pay attention to them because we think it's just the normal wear and tear of our bodies, especially if we've had babies. I've had 2 children. So of course everything, and I have a very short torso. So I just thought in my mind that maybe all of these changes and all of these feelings and aches and pains and things were due to me being old, or older, I shouldn't say old, me being older and having had 2 children and maybe needing a new mattress. I don't know, but those were the things that I attributed to all of the aches and pains that were probably due to the cyst that I had on my ovary. I never actually said the work that I actually had done. I went in not fully knowing what to expect. I knew that I would lose an ovary and potentially everything else. However, when the doctor got inside, she did not see any issue with the left ovary. So I only ended up losing the right ovary plus the cyst, and I elected to have my tubes removed just in case the Mirena was causing the issue. In my pre-op appointments, I had asked, do you think the Mirena is what's causing the cyst to grow? And both doctors said no, that they were fairly certain. I had a dermoid cyst, which is apparently something that you're born with, and it just grows over time, and it grows very, very slowly. And those cysts, the dermoid cysts, consists of like hair and teeth and skin and all kinds of gnarly stuff. But they tried to tell me that, you know, there was a very small chance that the Mirena was causing an issue, but I wanted to make sure that I had something in place just in case the Mirena had to come out, because maybe it was causing problems. So when I went in for surgery, the right ovary, the cyst, both tubes are removed. So I am left with my left ovary and my uterus intact. Now, that works out perfectly fine. I'm very happy with that, because that is what I initially thought when the first doctor told me I'd have to have surgery. I expected to heal a lot faster than I did. And I'm not exactly sure why I expected it. I think because I look back on my C-sections and in my mind I recovered a lot faster, and maybe I didn't. But with that being said, my C-section scar, both of them, was maybe 5 inches across. So just that. That's my C-section scar. The doctor told me in the hospital that they had to cut more. So I actually measured it when I was able to actually see my stomach and my scar. And my scar this time around is about 10 inches. It's like hip bone to hip bone. And I think I measured correctly. I don't do math, but I'm almost certain, because it's here to here when I put it down on my stomach. But that's a fairly large scar. And I'm thinking in order to access some of the things and to take the tubes out, they probably had to cut just a little bit more. She did tell me that they had to cut more than anticipated. So it's about 9 to 10 inches across. And she did not use stitches. I'm thinking that maybe there have to be internal stitches, because I can actually still, it's been almost 6 weeks. I can still feel some of the external stitches on the right side. No, on my left side, excuse me. And that's the side where I feel most of my pain still. I never really felt pain on my right side. I actually didn't feel anything at all other than like internal things. But on the left side is where I feel still a little more pain. Like, it's not bad, but I can feel it. And I can still feel the stitches that are poking through. And they fall off eventually. But unlike with my C-sections, I had stitches and staples. And this time they used glue, which was brand new to me. I'm not sure I liked it, but they used glue to close everything up. And then they put this rubbery plasticky stuff across the top of it. So it's almost like those like clear liquid band-aids. They put that across, and then you have to, I guess, take care of yourself until it peels off, which was slightly uncomfortable, because you don't know like if you're supposed to be peeling it off or if it just falls off and then it starts to get nasty looking. It's just gross. But yeah, so I had the glue to close it up. Expectations versus reality. I went into surgery thinking to myself, foolishly now, that I would go into surgery, have this surgery, and walk out and look just like I look normally, and maybe have a slightly flatter stomach because I just had this cyst removed. That is not at all how it works, and I don't know why I was thinking that. I legit came out of that hospital looking like I had just given birth to a baby. My entire stomach was swollen from like my bra line all the way down to my hips. Was completely swollen. I couldn't even see the incision. The stomach was so swollen. I was not ready for that. I wasn't ready for that one bit. I thought I was going to walk out of there looking like a supermodel, but I did not. The swelling goes away very slowly. Week 6 on Tuesday, I still can't put on my regular pants. I don't know what to do. I mean, it also could be due to me eating garbage, but like, I can't put on my regular pants. I just spent a ton of money on workout pants, and they fit like sausage casings. Like, I don't even wear them. I just wear sweatpants and big t-shirts every day. But yeah, I was so swollen I could not see the actual incision for about 2 weeks. And then that's me, like once I was able to see it, that's me standing in the mirror, like pulling my belly up and propping a mirror underneath it. And it's still like that now. Like I feel like now I look like I could be like 2 months pregnant, and it's just going down super slowly. When I went in for my post-op appointment, which is a 4-week appointment, I go in and I lay down on the bed and the little table, and she's like, oh my gosh, like your incision looks great. Everything looks well. You know, how are you feeling? And I asked the question of, might there be something wrong? Because the swelling, like it's still swollen. She says, yes, it's supposed to be. And I was like, well, how long does it go away? I'm still expecting to have a flatter stomach. And she says, well, I'm not sure what your stomach looked like before, because this wasn't my doctor. This was the physician's assistant. She says, but it looks great. She said, did you think you were going to come out like you had a tummy tuck? Actually, yes. Yes, I did. I thought that I would go in there, come out, have this thing removed, come out looking like I had a tummy tuck. And that is apparently not the surgery I signed up for. So I'm still waiting for the swelling to go down. And I think maybe in the next 3 weeks, plus if I give up all of the garbage that I've been eating, I'll get back. I think for anyone who has a surgery like this, you have to wrap your mind around the fact that your abdominal muscles are being torn and they need time to heal. Like I still, between my belly button and my pubic bone, I still have slight pain. Like if I touch it, the swollen part, there's still pain there. It's not like pain that I need to take medicine for, but it's not comfortable. And I can tell that it's still swollen. Like it feels swollen from inch 1 to inch 10. Like it's across the whole stomach. It's uncomfortable. So it's a much longer process for healing than one may anticipate.